Recording in progress.
Oh, yeah. Yes. I know what's happening. That's where it's just yeah. Yeah. One thing I need to have cell phone, wallet, and of course the reading glass. You know. Yeah.
Should we start?
I guess.
So many of us this time.
I know.
Yeah.
Yeah, we did.
Hello? No.
The green light, once a green light.
Hello?
Let me out. Let's see. That's on. This thing.
I wasn't close enough to it. Okay. Hello, how are you all? Dr. Modi Bailey is not here this week. Her daughter's having a child, apparently. So I would like to call the meeting to order. I think that it's going to be a little bit of a sparse crowd tonight. So welcome everyone. Today we have Dr. Miguel Vazquez, who's speaking to us. We're very excited to hear from him. He had been in practice for 20 years in solo private practice, and then he did clinical and administrative practice for 20 more years. But most recently, he worked with Blue Cross Blue Shield in their special investigations unit, and he's going to talk to us tonight about fraud and abuse. And so looking forward to that. First, we're going to hopefully approve the minutes. Have you all had a chance to look over them? Can I get a motion to approve the minutes? Second. Perfect. Motion and seconded. Approve the minutes. And then, okay. Yeah, I don't think there are any more announcements at this meeting. So I will go ahead and I don't know if there's normally there's someone from the trust here for to give a CME statement. But they're not here right now, so I will just turn it over to Dr. Vazquez. So he. Sorry? Thank you in advance for registering for CME credit for each session. And remember to complete and submit a session evaluation form so that we can continue to get CME credit. If you are attending virtually via Zoom, please mute your microphone and keep your cameras on when appropriate. Here is the CME number for today, in case you need that, which I do. Anything else? Is there another slide? Oh, yes. The AFP has reviewed the South Texas Regional Grand Rounds, and you can register your CMB credit online on the UTESCO website, make sure it's there, and then also on the AAFP website. Okay. Our grand rounds are address nationally established physician core competencies, as you see on the screen before you. Okay, now we're starting with Dr. Vazquez. Thank you so much.
Okay, well, just let me know if there's too much reverberation and maybe I'll talk without it. Good with this? Okay, let me know, just let me know. All right, so I'm Dr. Miguel Vazquez and I'm a family physician. I've been part of TAFP and the Alamo chapter for 40 years. So to get a diamond in the Yeah, actually, we started having these meetings even 40 years ago here. And once that time, this used to be a restaurant with a lady swinging from the 49ers or something like that, 1849 gold rush, that period. Anyway. Okay, so the topic tonight will be con artists, swindlers, and scammers, fraudsters by any other name. Okay, so I'll start with a little medical history. So back 1800s, early 1900s, doctors, pharmacists, back then called druggists, or really just about anybody could concoct a solution or a liniment and experimented on their family, their friends, and if it looked like it was pretty good, and if they had the guts, they'd go ahead and bottle it and try to sell it. So what I did is I brought some samples. Well, hold on. Sorry about that. I got ahead of myself. Clark Stanley gave us snake oil back in the early 1900s. And this particular liniment, I have a hard time seeing the screen here. Says that it's the strongest and best liniment known for pain and lameness. It's good for rheumatism, neuralgia, sciatica, lumbago, contracted cords, whatever that is. Good for frostbites, sore throat, insect bites, good for man and beast. So it was the first ivermectin. It's good for everything a liniment ought to be good for. Well, Mr. Stanley was finally was in 1917 when it was determined that this liniment was just mineral oil mixed with some herbs. And he did no contest and fined $20, $600 today, but still doesn't seem like a lot, right? However, old Clark went out of business, but the phrase snake oil is still with us. So whenever you think that someone's trying to sell you a full of goods, you don't know what you're getting, you might say snake oil is this. Yeah.
You know how much they have made?
No.
Versus the buying,
Yeah, no telling how much you never. Yeah, I don't know if he was the Elon Musk at his time or not. Probably not. I don't think he made a whole lot of money. Because there was a lot of people actually, so like I said, anybody could do it, could use that. So here's another example. Hamilton's wizard oil. And anything here, you can see the bottle is similar to the bottle, that you have at your table. And feel free to kind of share around with you. So you can read some of those bottles, and it will tell you that it was a good kidney liniment, or good for coughs and colds, heart and lungs, yeah. So they would patent these medicines, and create these bottles, put their name on it. Voila, make some money. So there's another one, Parker's tonic. The color's not really showing up very well, it's a nice looking label. The great health and strength restore. Right? So I'm not sure if this is supposed to be before the after, or this is the sun and the old man there, but anyway, come on, Dad. Perfect. Okay, the ideal brain time, specific for headaches, it's good for mental and physical fatigue, kind of marketed to women at the time. Oh, what was it? It was Coca-Cola. So back in the day, Coca-Cola had cocaine in the right? Early on, had cocaine. 7-Up and lithium. Lithium, yeah. Right. I'm sorry. Yeah. It's got a secret formula. I get it out of Hudson control life. Okay, and finally, this is kind of one of my words. Had a lot of cooties in there, so this isn't like cooties. Especially naked cooties. So here's the booty, preparing the medication, put it in the box. The next one is putting the lid on the box. These two over here are working on the marketing aspect. And finally, the last booty is to wrap the box. And voila, you end up with butter. How did that happen? Anyway, all right, going on with history of bringing forward a little bit. In 1961, President Eisenhower coined the term the military industrial complex, meaning or describing those individuals and institutions involved in the production of weapons and military technologies, but in particular, the growing political influence, right? So the U.S. came out of World War II, followed by the Korean conflict, and we became the biggest, largest, strongest military in the world. I think we're still there. But this is President Eisenhower saying we need to be a little bit careful. You know, this segment of the economy is getting a little bit large, a little bit too influential, and may not be good for us. So for any students and residents now, what I'll say is you have now entered the medical administrative complex in healthcare delivery. So what does that mean? The term used to describe all the different players involved in the so-called revenue cycle. So that's doctors, hospitals, B&B, suppliers, pharmacies, basically everybody in healthcare. So this will kind of explain a little bit of the revenue cycle. So this is just a graph that I put together. Really happy for myself because I'm not a graphic artist, I'm not an IT person. So it wasn't easy to put this together necessarily. But anyway, I like it. So revenue cycle begins when the patient accesses medical care. So let's say the patient is here, has a neck mass, doesn't want to go away, he's waiting for it to get better, it doesn't, calls his doctor. Dr. Doc said, well, we'll see in 4 weeks. No, I can't wait that one. I gotta go somewhere. Okay, look at it. Go to one of the freestanding ERs, gets evaluated. It's the it's like the neck mass. Usually they don't have any kind of radiology there. So they don't go to your doctor and get evaluated. Comes back, makes the appointment with the doctor. Okay. So the doctor now sees the patient. What you can do, the patient comes in with a neck mass. First thing you might do, maybe lab work, maybe what kind of radiology? Ultrasound, yeah, good. So you send them over here for an ultrasound. It comes back and tells you, whoops, like there's a neck mass there. Can't tell exactly what it is. You might need to order an MRI for a bigger picture. Goes back here, you order the MRI. Yep. There's a mass there, it's circumscribed. Best thing to do is to get a biopsy. So, consult the surgeon. Okay, go back to you, you find your surgeon you like to work with. Surgeon says, okay, let's put you in the hospital. Let's go ahead and do an excisional biopsy. Great, it's unbelievable. Fantastic. You're okay, come back in 2 weeks, we'll take out your stitches. Patient comes back home, so that's the end of the revenue cycle. Where it starts, when the patient comes in, and at the very end, there's no more charges. Okay, so the unsettling trend for us in this country is that healthcare is costing a lot. In 2022, with the last figures that they got, healthcare in this country, the health spend was $4.9 trillion, coming out to about 13,500 per patient per year. So we pay more than any country in the world, and people may argue we don't get the bang for our buck. Warren Buffett will not only cost the takeover of American economic competitiveness. The FBI estimates that 3 to 10% of healthcare billing may be fraudulent. That comes out to up to $600 billion per year. More than 36 billion just in a Medicare program. So that's a lot. Jeez, that's not even one. So what is the ultimate goal for any kind of fraud? What are they at? Money, 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 money.
Show me the money! Show me the money! Yeah! Louder! Show me the money! That's it, brother, but you got to yell that shit! Show me the money! I need to feel you, Jerry! Show me the money! Jerry, you better yell! Show me the money! Show me the money! Do you love this black man? I love the black man! Show me the money! I know!
Okay, money. That's what it's all about. Right? So fraud, waste, and abuse. I won't be talking too much about waste and abuse because you're not going to go to jail or doing anything like that. Basically, waste and abuse comes in the form of just not practicing well in your practice. You're over ordering things, over prescribing medications. So you're not going to get in trouble with that. Obviously, a lot of people who, a lot of doctors who practice extensive medicine, cover on the basis, every day it comes in the office, you have to run it up to run around. So that would be examples of waste and abuse. And like I said, you're not going to get in trouble. Maybe if people who are paying them, they're not going to do it. They want to do it, but it won't go to jail. So fraud is knowingly and willfully executing a scheme to defraud any healthcare benefit program, thereby receiving illegal gains. Right? That's the money. Key word is knowingly, therefore intentionally. The 3 important laws regarding fraud: the False Claims Act, the anti-kickback statute, and the Stark Law for Division Self-Report. False Claim Act actually was enacted back in 1863 during the Civil War. There's actually some shenanigans going on at that time with federal contracts. That came into being in 1863. And what it means today are these are issues related to improper coding leading to higher bill. So benefit services that are never rendered, which can occur in hospital services, physician, or other clinician services, home health, and hospitals, knowing making a false record or statement in order to get a claim to be. So who and where can fraud occur? Anywhere, wherever there's money, there's somebody wants to get to. So obviously it's not just in healthcare. All wherever there's credit card fraud, right? So, getting back to, the cycle. So where in this circle can fraud occur? Can you say it? Anyway, every one of these folks is an opportunity for fraud. Anybody who's trying to make a quick point illegally, okay? Freestanding ER or doctors, of course, and what happens exactly to those. Hospitals, wow, they charge lots of money. They're the biggest driver in healthcare costs throughout hospital services. And I like to say, this is my own opinion, is that with hospitals, they're the acceptable fraud, okay, because we like to charge high rates on a lot of their services. And to give you another quick example, let's say an 82-year-old person comes into the hospital through the ER. They got fever, shortness of breath. They get an X-ray. It looks like the patient's got pneumonia. Wiping out 16,000. Not looking too well. It's 82 years old. It's a little breath. Well, let's go ahead and admit it. So with admitting for treatment of pneumonia, with also diagnosis of rule out sepsis. Is that pretty good? Is that okay? Pneumonia, rule out sepsis. Yeah. That's probably part of the course. Person did it years old, yeah, almost anything is rule out sepsis. Okay, patient comes in, they're doing better than 24 hours. White comes back down to 10,000. Looks like he's taking his fluids and oral intake. So they discontinue the IV on oral medications. 24 hours later, still doing great. Now, something big, you're making your rounds, he says, I want to go home. And you look at him and go, okay, you're looking pretty good. Go ahead, let you go home, finish your antibiotic. So, hospital then bills for pneumonia and for sepsis. Okay. Now, the patient clinically does not have sepsis, right? And the doctor may not have even put it in the discharge summary. Nonetheless, the hospital will tend to charge for that. And they know it pay more than the diagnosis. But that's why I say it's kind of the acceptable product. And I can tell you, in the job that I have, we talked about the field, which was working in a special investigation team, is that we would talk to some of these people in the building department. And well, this is what we have to do. With all these diagnoses, besides the doctor's say in the notes, we're not septic. Doctor might have put that wasn't the time diagnosis. So well, that's what we do, and you don't have to just catch it. And that really, you have to catch us. Okay, so anytime there's also medical crises, there will always be somebody to come in and take advantage of it. So we had an opioid crisis. About opening up an addiction center. Okay, we can bring them into our addiction center. We're going to keep them in for 30 days. Always 30 days. And if you don't put them in the hospital, you might be as an outpatient. And as an outpatient, you might be getting a drug screen for a particular patient. Another 23 days, you're going to get a drug screen. And you're treating, and you're looking for all of the illicit drugs that might be out there. So in the end, this one particular patient, on an outpatient basis, could cost $35,000 per month. how many months is it? So that'll be a technical fraud. Laboratories. What's the next crisis we had? COVID-19. Okay, so what happened? Lots of COVID centers opened up. Maybe they were getting shots, maybe they weren't. They were testing just about everybody. They walked down the street, hey, you tested for COVID, and at the time, at night, he was gonna say, no, you know, you can't do that. So, went through a lot of dollars for that. Pharmacy, nursing homes broke out in hospital. These, tend to fall into the category of people documenting things in the record that actually did not occur. So it's easy to write down that you get a certain therapy at the bedside, or they serve medications, basic counseling, or whatever, and none of it ever occurred. DME, what I wanted to say here with regards to health fairs. So you do see health fairs from time to time, and a lot of times they're offering free services at these health fairs, right? So be wary. Free is fine. But so you know, they check your blood glucose, or they're checking your blood pressure, or they're checking cholesterol, or whatever. And then they have to be for your insurance. Okay, that's the key. Do not give them your insurance card. Even though it's free, you might ask, what do you think it's free? I don't like my insurance. Well, no, it's not really. The thing is, you know, you gotta protect that card like you protect your driver's license, your social security card, and your credit cards, same way. Because once they have that number, it shows you can start billing you for things you didn't know about. Okay. Medicare, Medicaid, the big one there is Medicare, the Advantage, Medicare Advantage programs. So in that particular system, you know, the doctor groups will get paid based on their diagnosis, okay? And what they call it? Well, it's a DRG of hospital, and on the outpatient side, it's a risk adjustment for. So, you know, patient that diabetes, not, and you know, they've got any other kind of complications with that diabetes, nephropathy. You'll want to code that. Your group will encourage you to code that because you will get paid more in that instance. So you always want to put in any complications associated with the diagnosis. Unfortunately, once again, if you get paid more, that means some people might end up putting diagnoses that shouldn't be, right? So if you have diabetes and you document or person documents, if there's some complications along with diabetes, and the patient actually does not have that, okay, that becomes a false claim at that point. Okay, so I'm going to probably help that just a little bit, because I worked with that for a while. So that hospital was calling me.
I had Medicare vehicle for patient for sleep apnea, and he had snoring, it's like the time night, 6 months later, they actually had many activities, you know, they get sleep apnea, and you know, so they would get reimbursed for the DME. I said no. But how do you report things to if it is being trained that's happening?
So who was asking at that point? Somebody in Medicaid here? Yeah. Yeah, if I do the DME, Medicare is the ultimate pay. They're not gonna wanna pay more. So very likely it's the B&B company that it might cost or something like that. And yeah, that's very, very easy for that to happen. They, you know, whether it's really. Yeah, I mean, yeah, you wanna make sure who you talk to, and obviously. You don't wanna do anything that if you know, is not going. And they'll put a little bit of pressure on you too. So health plans, the health plans, you need to have, not the health plans, right? Okay, so I picked on a couple of health plans. And I also put their moniker on the side. Because what health plans like to do, they like to get about every 3 years to come up with a new marketing vehicle, right? To go along with their insurance. So, yeah, and their little marketing plan is more. Together, we give health first and everything for this. Okay, well, they agreed to pay $90 million to settle a false claims act related to their Medicare Part B contracts. So Part B has to do with medication. If the health plan wants to work with Medicare, they have to apply to Medicare. And they have to obviously put down what they're going to do, how to do, I mean, the form, the long form. So the lawsuit alleged to be insurers submitted bids to the federal government that were fraudulent in 2011, 2017. The matter said that it would offer the mandated level of coverage in its bid, but behind the scenes, planned to pay less. Which led, well, because of the enrollees unknowingly picking up more than their fair share. So in other words, if you have a bid to Medicare, let's just say here's a medication cost $100. So you might say, okay, we're going to pay $80 on that particular medication. Okay, that's good. We can bring Medicare. We got some. Fast forward, patient gets that medication, demand ends up paying $60 instead of the $80 that they agreed to, right? So the key words here, these come off, headlines and whatever, articles. The key words here was that behind the scenes, they plan to pay less. Well, who would know? Behind the scenes. That's going to be another employee at EMAC. Who knows what that? Okay, so they're the so-called whistleblower, right? They're going to whistle on someone. They see something's happening, and if it's on a large scale, and there's a plan to it, and they're planning to do these things, then that's fraudulent. And once again, the whistleblower has to have a little courage to come forward and report that. Cigna, including the lives of the people we serve. Well, they paid $172 million to resolve their false claim. And what they did was this had to do with the Medicare Advantage program. And once again, basically upcoding the diagnosis. So it would, diabetic with all these complications, don't have that complication, and so forth. Yes, yeah. And I just happened, not too long ago, probably Blue Cross Blue Shield, my former employer. Oh, they're not recording this. Okay. Their monitors, we stand by it. Okay, but they have to pay $25 million to settle their claim. Some of the resolved claims that Blue Cross Blue Shield wrongly terminated insurance coverage for private duty skilled nursing care for medically fragile children. In order to shift the costs of such care to the Medicaid program. So unfortunately, these are people that actually have insurance, and they try to get them off the insurance. And when they got caught, then I had to pay 25 million dollars. All right, could be used for something different. Okay, individual doctors. I picked on this particular doctor just because. I don't know, I don't know what to call it. Anyway, so here's the headline. This doctor found guilty for rolling a $325 million healthcare fraud scheme involving false diagnoses of lifelong diseases. So he's a rheumatologist. He falsely diagnosed a large number of patients with rheumatoid arthritis and then treated them with medically unnecessary medications.
So I went to none of this going out.
He did.
Permission, and a lot of his patients came in, and we had to take them off these medications. They're like, I want a refund. And they're like, they're trying to do.
I need to reveal the light, right? I never heard of it, situation, right? Yeah, wow, that's, yes, you have a little, you know, a lot of knowledge about it. Yeah, that's, you know, I think there's so many that didn't really trouble, right? But might be hundreds of patients. We're gonna have $25 million. And some patients were as young as 13 years old. Okay, man. So I'm gonna look at operating clinical practices throughout South Texas and San Antonio. He travels to his various offices in his private jet and his Maserati. The going was good for a little while. He's in prison now. Okay, this one hurts. This one hurts. Bail upon medicine, right there in the house that baby go. So Baylor College of Medicine, English Hospital, and Surgical Facilities in South Texas. Alleged 3 prominent Houston heart surgeons, the leading residents and fellows alone during critical portions of their heart surgery, which allowed them to perform multiple surgeries at the same time. So they would start surgery in one operating room, get to a certain point, or they would be called. The doctor who got the next patient in OR 10, okay, let me get right over there and let the resident continue on the first surgery. So the allegations were the patients were under anesthesia longer, had more complications, including death. There were 3 surgeons involved in this case. Surgeons' compensation of these 3 was 49 in Houston average, meaning it was about $2 million that they were getting a piece. And then St. Louis Hospital during this time, within $150 million. So once again, it was a whistleblower, we brought it forward, actually one of the other surgeons in the group. Okay. And by the way, if you're a whistleblower and you're successful in these particular cases, you also share in the verdict. I was going to say the winnings. The verdict. And so in this case, usually it's about 20%. Well, you got 20% of $15 million. They settled for 15 million and the charge was. Okay, so none of this shows up in the doctor's recipe anymore. If you look at we didn't do anything, we just settled. Okay, the anti-kickback statute that started in 1972. Prohibits the knowing of payment of any kind of remuneration, money, to induce or reward patient referrals or to increase business. So this was a hospital in Dallas called Pine Creek, and what they wanted to do was help pay for radio, TV, ads for the doctors, brochures, and business cards, which, you know, that's okay, actually. It's okay if company wants to do that for, you know, some of the doctors that they got. However, you sit there and decide to say, we will do this if you refer your patients to the hospital, then that becomes the problem. Okay, so it's a tick tack. That's the way, so it becomes a kickback at that point. Manhattan US attorney launches a $50 million settlement with Walgreens for paying kickbacks to employees to induce beneficiaries to fill their prescriptions at Walgreens. But, you know, if you remember, there was a time we probably didn't have like prescription drug cards. And so if you had one of these cards, you were part of the club, you could then shop at Walgreens, save some money, prescriptions or other items in the pharmacy. Once again, that's okay. It's okay to have a prescription card plan. You can send it out. It's a marketing deal. However, these they were paying their employees to sign people up. And if they were successful in signing these people, well, then they would get a component in the future. Well, now that becomes a kickback. So, you know, it's a big deal. Maybe not for just the little Walgreens down the street, or we multiply that across the nation. You know, at the end of the settlement, it's $50 million. Okay, how about electronic medical records? How can we get fraudulent medical records? So there is a company called Practice Fusion. Anybody heard of Practice Fusion? No. What EHR do you use? ECW? I've heard of that one. That's probably. Another one, anybody? Others? Epic. Okay, that's a big one. Yeah, so this one's called Practice Fusion, so it's probably maybe not as big as Epic. But so Practice Fusion admitted that it solicited and received kickbacks from Purdue Pharmaceutical. Wow, what do they make? In exchange for utilizing its electronic records to influence physician prescribing of opioid medication. So what they did is they embedded within the EMR something that's called a clinical decision support method. Right? So it probably popped up whenever a patient was taking a narcotic, like you mentioned, pain the record, that would pop up and maybe it would ask, well, have you considered OxyContin? This patient you know, maybe you could, I think maybe you switch over. Consider OxyContin. Just go inside of it or whatever you want. Yeah, so the thing is that, you know, in good news, I mean, residents or people using the EMR, they might be going, wow, this is great. This is fantastic. This is a nice word. It's kind of the word for this kind of things. No, sorry. So anyway, Purdue's on all kinds of people.
Yeah.
Start law is a self-referral law for 1992, so a patient should not refer a patient for health services if there's any financial relationship between the physician and that healthcare entity, right? If you're an owner or a partial owner of a hospital, lab, B&B, pharmacy, home health, do not refer it. Don't refer it. And if you get caught, you might have a problem. So it's designed for writing conflict of interest. So who is involved in starting laws? Obviously, yourself and members of your family. That's going to include your husband and wife, a child, a stepchild, step-parents, step-brothers, step-sisters, in-laws, even grandparents. Okay, so don't refer to your grandparents and left down the street. Okay, so I'll finish up with this particular, kind of going back to the beginning of the whole Stanley Clark and his snake oil. Everybody here is president. See a lot of commercials about privileging, improving your memory. Improve memory, supports health and brain function. creates a sharper mind, clearer thinking. Who doesn't want that? What's in it? What is it? Vitamin D. Vitamin D is in the beverage. And something called apo and ori. It's something that they say they found in jellyfish. Okay, the jellyfish magic. So, yeah, that's what it is, and I see these commercials all the time, so I'm not a resident, so I can watch TV. And just this year, the Attorney General was issued today, maybe you heard about it. She won a trial against Quincy Bioscience for deceptive and fraudulent advertising of memory improvements strategy. So, I suppose that only maybe applies in New York, because I saw privilege. I know it's part of the commercial. So maybe they're not allowed to do any kind of marketing in New York. Okay, and that's it, you know, it's all about the Benjamins, right? Money, money, money. Okay, very good. Any questions or comments? Any questions or comments about anything?
But if we keep it around, a lot of that was just the marketing. Well, you know, like, May help. I was asking, can you get around these fraud claims just by adding magic words like may help? Like not only does it, you're not guaranteed, it just helps us fit what the goal. It might be, we don't know. Like may help reduce, like with blah, blah, blah. It means nothing to you, right? You can get away with that.
Wow. That's going to be a relevant question by saying things like that. What do I say about a small snake oil? It may help. May help, yeah. I mean, I guess it actually came out as benefit. I mean, it's going to help your kids. So you're not planning to will, right? It may help. So, should buy it might. Yeah, of course, we do have applications, right, for dementia. Need those don't work that well at this point. So if I say Levagen or Deriva, you know, it's gonna be the magic, gonna be the magic spell. Exactly. All right, so very good. Don't do anything bad. Don't make money under the table. Great.
But the year in new product ways. And analyzing. So how much money is wasted? Like I think about lab, for example, and I think about here that I'm like, oh, you have one time each. And say you use it today, like we're in the or the things maybe and that's how how much of that at least screening there did it need to be restrained? Like I feel the money.
No, are you a resident? Yeah. We could give yourself a lot. But yeah, you know, what the relative rate of fraud is coming in. I would like to see a life being more. Because I was thinking it's a set on the world we use. And, it can be things in medicine, you know, like, you're always trying to cover all the bases, so, you know, I don't know. So, I think the game line is good, the whole game. We're getting, we'll get this. Really? You can't even buy it done. And what we're doing is more conditions, you have the opportunity to follow up with the patients, right? Now, you know, a lot of doctors, especially doctors, now you have to see patients. Share it out of the ways as possible. As family physicians, I mean, you're gonna be seeing this patient over and over. So a patient comes in with a headache, you examine, you think about it based on their symptoms. Think of your migraine, headache, think of your migraine, looks like migraines. You go in and treat for migraine, right? Send them home. But what you can do, of course, is tell them, call you back, or you follow up with the patient within a couple of days. Or the other thing, you got better small one in 2 days. Didn't always work for my practice. It's not how you all the come back and not getting better. It's really tend to come back for the most part. Or they end up maybe going to the emergency room and they come back. But I mean, so that's the key is follow up. You have a chance to follow up with those particular patients so that you don't have to jump and try to do everything at once. You know, the ER doctor might want to do that, once in your patient one time at this point in time. And they're gonna want to cover as much as they can, right? Because they might not see the patient again. But as family doctors, you do have that opportunity to bring them back. Good question.
We're in the fraud area, correct? And the special investigations. Do you have a certain regional area? Are there another region cover like the other area? Any other areas other than the world?
Oh, yeah, no, we are from people.
You covered 5 states. Okay, so technically, Mexico, so that is kind of our role. If we want to do this really do not all the other health plans have that type of duty as well. You have to be kind of a good size in order to see that. Otherwise, I mean, no plan will definitely do analytics and just to kind of be trained of how doctors for billing for the most part, you know. Because you know, it should be for family doctors in the office when you see patients. It's going to be a factor in terms of how you're charging those patients. Most of them fall in the middle, 992 and 3s, right? Small portion of 20%, down to 92 and 2s. A small portion, 992 and 5s, with the extended office. You know, if that curve starts shifting over, you see a practice for 90%, 992 and 5s. Okay, it doesn't look right. So the first step, you're gonna have to delve into the billing, and you can have to solve it. You actually pick up the phone or you know, the doctor in the place. It's billing like that, and have a conversation, you know. Educate what's happening here. Yeah, it's basically very simple. Everybody refers to my points, they know I'll take care of it. Okay, well, thank you very much.